Hello, I'm Dr. Inman. This is a series of informational videos about various disease conditions that we use to treat with Veterinary Orthopedic Manipulation and Myofascial Release. This one is about urinary and fecal incontinence. Urinary incontinence and fecal incontinence is the disaster in veterinary medicine. Very commonly, the animal is doing fine in the front, but the back end isn't doing okay. The animal can't control bowel and bladder, particularly urinary tract problems. If the animal starts to pee in the house, and continues to void in the house, they start to destroy the house and they stop becoming a pet. Very commonly, if we try medical approaches and that does not work, the animal ends up having to make what veterinarians call the last trip to the veterinary hospital, which a relatively cognizant and normal functioning animal, except for their urinary tract or fecal system, isn't functioning, but the rest of the dog is fine, and that dog ends up having to be euthanized, which is unfortunate, but nonetheless that's a disaster. So very commonly the last trip to the veterinary hospital can be for urinary and fecal incontinence, and that's the only thing. Now we can use all kinds of techniques to try to treat this medically. We used to use diethylstilbestrol, phenylpropanolamine, and a number of other dexatrim, which is a diet product that can in fact give the bladder more and more ability to contract itself. But it's imperative to understand that the micturition or the urination reflex in the canine is the most complex neurological phenomenon that the body does. It actually involves the muscles of voluntary release of the urethra, which is very commonly compromised by neurological interference that is occurring in this animal's lower lumbar area here. It also involves the sacral nerves, which involve parasympathetic release to the bladder to release itself, sympathetic tonus, which comes off from this area of the spinal cord, and voluntary control, which comes off from the brain, essentially. Not only that, it requires a certain amount of tonus of the urethral sphincter, and a lot of times in neutered females, for instance, spayed females, they don't have enough estrogens in their system over 10 or 12 years of being spayed to have adequate amount of tension to their urethral sphincter. And because of that, we can sometimes add some diethylstilbestrol or some estrogens essentially to increase that, although they have severe side effects sometimes too, so that doesn't necessarily solve the problem. What we found when we saw these dogs that came into us, a lot of them had problems of thoracolumbar spinal subluxation phenomenon and neurological interference. And when we went ahead and we adjusted them, because they presented themselves for lamenesses or other kinds of problems, not like the ones that we show you on vomtech.com, but rather when we did that, their urinary tract problems went away, essentially, and that indicated that they did not have voluntary control for them to release the urethral sphincter. When they can't voluntarily release their urethral sphincter, voluntarily with control of their brain when they go outside, then what happens is the bladder just continues to swell up until it overwhelms with pressure, and then it leaks, and more commonly than that, it'll leak at night when they're asleep. And it's miserable for the dog, but nonetheless, it is also a condition that's very commonly puts them into the veterinary practice with a condition that doesn't respond to medical therapy. We have a tendency to use just this particular approach first to see if this solves a problem, and well over 75% of these animals respond positively when we go ahead and adjust their lower lumbar area. Remember that most veterinarians, almost no veterinarians, actually utilize this technique. And virtually every animal over 10 or 12 has vertebral subluxations in their lower lumbar, and so they're on the way to getting this problem, and they're going to have some degree of that by the time they finally end up their life, essentially. However, if they have it more severely before they run out of gas, their liver and their kidney gives up, for instance, then they end up with the urinary incontinence. So it's relatively common and somewhat disastrous to see in a veterinary patient, mostly dogs and cats. The canine, we go through and we adjust them just like we do in every other situation, addressing the lower lumbar area, which is compromised, for voluntary control to release the urethral sphincter, and that's what the basic adjustment does. There's another therapy that we will also use, and there will actually be a somatovisceral therapy where we'll go in and we'll actually rehabilitate the sympathetic nervous system by using what we call veterinary somatovisceral therapy, or an autonomic nervous system disease. The VOM technology, unlike any other technology in the world, actually adjusts the autonomic nervous system of the dog, the cat, and the horse. We show you that in Module 4 extensively and show you what it is like this condition that we can in fact successfully treat. So we go up like this on either side and we rehabilitate the sympathetics, and then what's like this, it would be from side to side as we're going over the paravertebral ganglion and rehabilitating them. They go from T1 to L3, And then we come back to the sacrum and we do the sacrum. The sacrum actually has parasympathetics into that area. And this is the pelvis, for instance. The dog is up here, the sacrum's here. And so we'll actually adjust the sacrum too. And as we put energy into the sacrum, we rehabilitate the parasympathetic nerve systems into the descending colon and also the bladder and the urethral sphincter in those particular areas of the body. So that can rehabilitate bladder and fecal control. Very commonly, that area of the body's active control mechanism are just flaccid or they're not functioning, and so they really don't have the ability to control adequate bowel and bladder, essentially, and that is how we go about taking care of it. Another therapy that we'll actually use is what's called pre-vertebral stimulation. We'll actually put this particular instrument and we'll put it on the bladder, we'll put it on the colon, for instance, and we can do that. This works in people too, essentially, for that condition. We'll put it right on the gland, and what we're doing is we're stimulating the presynaptic cell body of origin of the actual parasympathetic nervous system, which exists in the serosa of the gland itself. So we're actually putting it right on the bladder. We're putting it right on the descending colon as a means to rehabilitate that. Our success rate is very high. It's actually over 80% for these animals, which is delightful. Very commonly we'll use that with a combination of medical therapy. Also, there is no surgical extirpation that basically solves this kind of problem, but this condition has solved these animals. Now, we may have to adjust them the first, second, and third time over a week or 2 week period of time to get them straightened out. We may have to adjust them 5 or 6 times to keep them straightened out. We may have to bring them back, the really old animals, every 6 months and adjust them a couple times to make sure that they don't continue to void in the house. The nice thing about this is when an animal does respond to this type of therapy, we can keep adjusting them like once every 4 or 5 or 6 months until they finally get so old that their liver and kidney give up and they basically pass away because they've been quote-unquote worn out. But we don't have to put them down for urinary and fecal incontinence prematurely because we can't fix this particular area. This particular area is caused by neurological interferences that we find and we remove with this technology. I would encourage you to go to the website vomtech.com and actually look into this particular therapy. We'll show you how to do it, when to do it, essentially, why it works, and also how to apply it in your practice. And I look forward to talking to you about a number of other amazing disease therapies that we've used and developed over the last 35 years. Thank you, and have a great day.